Hello and welcome back for more human physiology. So today we are going to finish up chapter 1. We have just a couple of things left to cover, mostly as it pertains to medical imaging. So let's go ahead and get after it here. So I've said it before and I'm going to say it again, and you'll probably hear me say it again in the future. This is not an anatomy class. We're not going to turn it into an anatomy class. We're going to focus as much on function as we possibly can. But there are going to be times in which we need to use anatomical terminology to refer to specific locations within the body. Now, we're not going to get too crazy with this. So we should be able to kind of get away with the bare minimum in terms of terminology that you would normally find confined to an anatomy class. So 4 terms in particular. So these are pretty simple. If you've already taken anatomy, you're going to kind of scoff and say, oh, this is child's play, right? So anytime we use the term superior or inferior, we're referring to things that are either above or below a certain point. So, for example, the brain is superior to the heart and the stomach is inferior to the heart. So the brain is above the heart, the stomach is below the heart. So the heart in that case is our frame of reference there. And then otherwise, the terms anterior and posterior will serve us well. Anything that is anterior to something else is in front of it, and anything that is posterior is behind. So just automatically, we assume that the front of the body, meaning where your face and kind of your belly is located, that's going to be the anterior side, and then your back and buttocks and everything like that is on the posterior side. So there will be times in which we need to use these pieces of terminology, but like I said, we're not going to get too crazy with turning this into anatomy hour. So body cavities, something to be aware of. We will, as we introduce new organ systems, we will obviously want to make sure we understand where these particular organs are located, especially as it pertains to different body cavities. So we kind of talked about this in terms of the compartmentalization aspect of human physiology. So a lot of what these body cavities are meant to do is to house different organs while preventing incompatibilities from occurring, and then also preventing damage from abrasions occurring. So if you look at the leftmost figure, the lateral view, which is kind of a person kind of in profile looking to the side, the anterior cavity is going to contain kind of 2 cavities on its own. It contains the thoracic cavity, which is there in purple, right above the line of the diaphragm, and then the abdominopelvic cavity, which is everything below the diaphragm. And then behind there is the posterior cavity, which is going to contain both the cranial cavity, which is where your brain is located, and the spinal cavity, which is where the spinal cord is located, which kind of threads its way through the vertebral column there. And another thing that we will see in the future, not necessarily right this minute, but we will see that many of the organs that are contained within the body cavities are encased by what are called serous membranes. Now, serous membranes tend to come in pairs. You have both a parietal membrane and a visceral membrane. So the idea here is that the parietal membrane is basically kind of stuck to the wall of the body cavity itself, whereas the visceral membrane is kind of stuck to the organ itself. And then there should be a very small amount of space in between the 2 membranes, which leaves kind of a cavity in and of itself, which is called in kind of generic terms of serous cavity. When we talk about the lungs, we'll call it the pleural cavity. With the heart, we'll call it the pericardial cavity. So what we call those cavities is kind of specific to the organ itself. The best way, and I think the book does a really good job of this, of kind of picturing what that cavity looks like, is to kind of look at the picture here of someone making a fist and then kind of pressing down on a balloon like that. So the one side of that balloon that is making contact with the fist would be very much like the visceral serous membrane, and then the part on the outside, on the opposite side of the fist, would be very much like the parietal membrane. So you can see that in between the 2 membranes there is kind of an empty space there. Now, this empty space is not going to be filled with air like it is in the balloon analogy. There's actually going to be very, very, very little volume there in terms of stuff that can occupy that space. There will be a small amount of fluid there, especially in the case of things like the heart and the lungs. So, the whole idea of serous membranes is not something that we're really going to see a payoff until probably at least chapter 19 when we start talking about the heart, but it is something to kind of be aware of since we have talked about the whole compartmentalization aspect already in this chapter. So serous membranes tend to be called different things depending on what organ you're talking about. So the serous membranes that encase the heart is called the pericardium, the lungs it's called the pleura, and then just for the abdomen in general it's called the peritoneum. All right, so for the topic du jour, medical imaging. So earlier on in the chapter when we kind of talked about methods of anatomy that we can use to kind of study structure and function, we talked about things like dissection and things of that nature, things that tend to be very invasive. Well, another thing that we mentioned is that the really nice thing about imaging techniques is that this allows us to study both the structure and function of internal organs and structures without really getting too crazy with cutting into someone, right? We can do this while minimizing invasiveness. So most of what medical imaging encapsulates is the utilization of electromagnetic radiation and having this radiation pass through the body, and depending on how internal organs or structures interact with that radiation, we either can or cannot capture that particular structure with an image. So before we really talk about individual imaging techniques, we need to make sure that we kind of have a very basic understanding of electromagnetic radiation itself, so light. So light comes in a variety of different wavelengths. So light, as you may or may not be aware, has both particle and wave properties. So if you consider light on its wave properties, if you kind of look at this part of the graph up here where we kind of have these wavy lines back and forth like that, you'll notice towards the left side here, these waves are very kind of choppy and up and down. The waves happen with great frequency. Well, the way that we define wavelength is the distance in between two consecutive peaks on kind of two peaks that are right next to each other. So on the very left side, you'll notice that there's a very short distance in between consecutive peaks. And then as we move to the right, that distance gets greater and greater and greater. So that's exactly what we're talking about with wavelengths. Light that has a very short wavelength is going to happen with great frequency. The waves happen da-da-da-da-da-da, right one after the other. And then light that has a very long wavelength is going to happen with very low frequency, and there's a great distance in between one wave of light and the next. Well, the reason we want to be aware of this is because the wavelength of a certain type of light says everything about how much energy is in that light. So the idea is this: the shorter the wavelength, so over here on the left is the shortest wavelength, the shorter the wavelength, the more energy the light has. And conversely, the longer the wavelength, the less energy the light has. So if we look at some of the different types of light that are listed here, the ones that have the most energy are going to be listed here on the left because they correspond to the light that has the shortest wavelength. So gamma rays are going to have the most energy. Living here on Earth, we don't ever get exposed to gamma radiation, and for good reason, because it would fry us for sure. X-rays are next. X-rays do contain quite a lot of energy, as we will discuss here in a minute. UV radiation contains quite a lot of energy, as I'm sure you have been aware of in your life if you've ever gotten a sunburn. That is just your skin reacting to all the energy it's absorbed from the UV radiation. And then right after UV radiation is the visible light spectrum, which contains all the light that has colors that we can see. When we get into the nervous system, particularly sensory physiology, we can talk about what it is about your eyes that allows us to see those wavelengths of light. But then after visible light, so visible light is everything from approximately 400 nanometers of wavelength to about 750. After visible light, the even longer wavelengths include infrared radiation, which we cannot see, microwaves, radio waves. So radio waves is a particularly interesting one to consider. So radio waves have very, very, very long wavelengths, and this is a perfect thing to discuss in terms of energy, because since there are thousands of radio stations all across the country and all across the world that are just constantly broadcasting radio signals, what this means is that at this very moment, as you sit in your chair or on your couch or wherever you're watching this video, your body is constantly being penetrated by radio waves. So every second of every day, you are being exposed to radio wave radiation. But this is not anything for you to worry about in the slightest, because radio waves are such long wavelength radiation, and therefore they contain such little energy that this type of radiation poses no threat whatsoever to any of the cells in your body. Okay, so now that we have a rudimentary understanding of electromagnetic radiation in terms of wavelength and energy, let's start talking about individual imaging techniques. So the X-ray seems an appropriate place to start. X-ray is obviously one of the oldest medical imaging techniques. You can see an X-ray being performed here on someone's hand. So, as we discussed on the previous slide, X-rays are high-energy waves, and as such, they can easily penetrate gases and low-density solids. So that's kind of the thing. The more energy a type of light has, the easier a time it's going to have penetrating certain body structures, but also you can also get some damage to those body structures as well. However, X-rays do not penetrate high-density bone and some of the softer tissues inside, which means that if you take an X-ray of someone, what you're going to see is basically darker places where structures did not allow X-rays to pass through, so you can actually see some nice contrast here in terms of what did the X-rays pass through and what did they not pass through quite as well. So in this case, the X-rays passed through a lot of the softer tissue in the hand, but they did not pass through the bone quite well, so you see kind of less exposure here for the bony parts and more exposure for the other parts. So you get a nice contrast there, so you can get a good visual detail on bone there. But as I was mentioning, because X-rays do contain a lot of energy because of their low wavelength, they are capable of damaging cells and tissues, especially those that are most sensitive in terms of their DNA. So nowadays, now that we understand this better, oftentimes when you're taking an X-ray, even if you're just getting X-rays taken at the dentist's office, they'll usually have you wear a lead apron over most of your body so you can shield your most sensitive cells. So if you're a man, we're talking about the testicles, and then for women, we're talking about your ovaries. Those are going to be the most sensitive cells that you rely on in terms of their DNA and what it means ultimately for reproduction. So moving right along here, CT scans, the CT stands for computed tomography. This is basically the X-ray on steroids. So what a CT scan is essentially is multiple X-rays that are taken at kind of different angles and different depths, and those individual X-rays can kind of be pieced together into something of a pseudo three-dimensional image. So think of it kind of like a three-dimensional X-ray. So even though a single X-ray is kind of more for looking at bones, CT scans, because you're getting multiple X-rays kind of at different angles and depths, we can use it to look at softer tissue like the brain or like the liver. So this picture that you're looking at here on the left, we're looking specifically at the brain. So just a single X-ray of the brain probably wouldn't do us much good, but multiple X-rays that are kind of all taken at different angles can give us some nice detail in terms of what the brain is looking like. But the drawback here is fairly obvious. So one X-ray has a lot of energy. Think about how much energy several X-rays have. So you don't want to get into the habit of getting a lot of CT scans done, because every X-ray and every CT scan exposes you to a dosage of radiation. So it's definitely something that medical practitioners have to consider when they're trying to figure out the best course of action in terms of how to take a picture of something. So MRI is another common one, so magnetic resonance imaging. This one is kind of unique in that it does not actually utilize radiation. So rather what we're looking at is a powerful magnetic field that is being applied to a particular person. Now, when you hear the term magnetic field, you automatically think of metals. So you're thinking, okay, well, how's that going to work? We don't really have any metal in our body except for maybe some ions like iron and things of that nature. So here is the idea behind how MRIs work. So this powerful magnetic field is only going to have an effect on certain atoms in the body. Specifically, it's going to have an effect on atoms that have an odd number of protons, which is something that we'll talk about in Chapter 2. So if the whole proton aspect of it kind of confuses you, you might consider revisiting this slide after we've had a chance to go through Chapter 2. So just to kind of give you some examples of atoms that have an odd number of protons, hydrogen has 1, lithium has 3, boron has 5, so then 7, 9, 11, 13, 15, and so on. If an atom has an odd number of protons or an odd atomic number, it is going to be affected by a magnetic field. So we don't need to worry about all the atoms that have odd numbers of protons. There's only one that's really important here, and that is hydrogen, because hydrogen is by far the most abundant atom in your body. So when hydrogen or some other atom that has an odd number of protons is exposed to the magnetic field, these atoms are going to emit radio waves. And like we said, radio waves have a very low energy, so there should be minimal risk here. So the reason why this is important, and the reason why MRI imaging is so kind of diverse and multifaceted, hydrogen is found everywhere in your body. It's found in the water that is found in every cell and every tissue in the body. It's especially abundant in fat molecules. So we can use this technique to study a lot of different body structures. Anywhere there's hydrogen in the body, an MRI can detect that particular structure. Now, the drawbacks here is that the MRI is kind of a pain in the rear. It's a pain for the patient. A lot of patients experience great discomfort being kind of enclosed in this narrow space for a long period of time. MRIs tend to be very costly, so that is definitely something to consider as well. But if you can get past those things, the MRI is a pretty powerful technique. So PET scans is probably my favorite in terms of, as a physiologist, I find it most interesting because this is a type of imaging technique that can give physiological insight rather than just anatomical insight. So what the PET scan, or positron emission tomography scan, does is it utilizes some type of radiopharmaceutical that gives off radiation on its own. So this will be something that we talk about a little bit more in Chapter 2 in terms of, well, what types of chemicals give off radiation. Well, depending on what you inject into a patient, you can actually measure physiological activity depending on what type of chemical was administered, where does that chemical accumulate, etc., etc. So a couple of examples here. We can actually measure brain activity by injecting a patient with radioactive glucose. So this is glucose in which the carbon atoms in each glucose molecule are radioactive, so they're carbon-14. So glucose tends to be very much used by the brain, so we can inject someone with radioactive glucose and watch the brain start to light up over time. And the parts of the brain that light up the most indicate which parts of the brain tend to be the most active. And then the picture shown here on the right shows different tumors in the body lighting up with radioactive glucose. Tumors, cancerous tumors, also tend to be highly reliant on glucose metabolism, so they tend to light up as well. So this is a powerful technique in and of itself. Another example, something a little bit more innocuous, something more innocuous than, say, looking for cancer, thyroid activity can be measured with radioactive iodine. We will learn about this in Chapter 17 on the endocrine system, but the thyroid, which is located in your neck, is just about the only tissue in the body that uses iodine for anything. So if you inject someone with radioactive iodine, after a while you should see the thyroid light up like a Christmas tree. And then finally, the last technique for us to talk about is ultrasonography. So just as the case was with MRIs, ultrasonography is not really utilizing electromagnetic radiation, meaning that it's going to be very, very, very safe. This is by far the least invasive and safest of the imaging methods that we have discussed so far. So we are not using electromagnetic radiation, rather what we're using is high-frequency sound waves. We are dispersing sound deep into the tissue, and then based on the way that the sound waves are dispersed by some of the internal organs and tissues, we can generate an image that way. So this is going to be a very good choice due to the safe nature of it for very sensitive subjects like developing fetuses. So when a pregnant mother goes in for a checkup, oftentimes what will happen is they will do an ultrasound to take a look at the baby. Now, for kind of wellness visits, which you typically expect, we don't need a great deal of contrast and image quality to kind of have a good idea of what's going on. So ultrasonography is a good choice for that. Minimal risk to the baby, and otherwise we should be able to get the kind of information we need. But as you probably saw coming, the downside is that since we are not using electromagnetic radiation, and because sound waves do not penetrate through structures easily at all, the image quality is going to be very poor in comparison to some of the techniques that we've talked about so far. So again, another thing that you have to kind of weigh depending on what do we need to accomplish versus what is the risk to the patient. All right, so congratulations. You are all done with Chapter 1 lecture at this point. So Chapter 2 is going to focus on a little bit of chemistry review. We're not going to get too terribly crazy. We're just going to try to get you caught up on atomic chemistry, molecular chemistry, with particular focus